Dewa.
Thank you, Mr Acting Deputy President. Thursday, March the 21st, in other words the day after tomorrow, is National Close the Gap Day. We'd like to acknowledge all of those who have supported and participated in this event, both in the past and in the events on Thursday. There will be events happening around the country. The evidence is clear, however, that there are still significant differences in health, education, employment and social outcomes between Aboriginal and Torres Strait Islander peoples and other Australians. National Close the Gap Day is an important opportunity to promote awareness of these issues and to take collaborative action towards improving the health and well-being of Aboriginal and Torres Strait Islander peoples. We'll note here too that Close the Gap Day is the community-owned initiative, whereas Closing the Gap is the government's program that addresses these issues. And it is important. It may sound pedantic, but it is important to point out the differences between the two. The Shadow Report of 2013 on the government's progress towards closing the gap in life expectancy between Indigenous and non-Indigenous Australians outlines some progress in some areas, such as Indigenous child health, although there's been some progress there, unfortunately there is some plateauing in the mortality rates in children under the age of 5. As well as there's also some progress in reducing the rates of smoking during pregnancy and increased attendance at antenatal care of at least one visit during the mother's first trimester. Early data indicates that tackling Indigenous smoking and Indigenous chronic disease package initiatives are showing signs of being beneficial for adult health and life expectancy, which is very promising. However, National Close the Gap Day serves as a reminder there is still a long way to go to close the gap between Aboriginal and Torres Strait Islanders and other Australians. Most Australian jurisdictions will not meet the Council of Australian Government's target to achieve equality in life expectancy of those Aboriginal and Torres Strait Islander people living in Australia by 2030. There has been an increasing trend of babies of low birth weight born to Aboriginal and Torres Strait Islander mothers, and we know low birth weight is associated with later health problems, as well as a greater risk of mortality before the age of 5. Funding cuts as those reported in some of the states, such as New South Wales and Queensland, will unfortunately have a potential detrimental effect on efforts to close the gap. There is an increasing need for further funding for the National Aboriginal and Torres Strait Islander Health Plan, which is funded up until June this year, but as yet there has been no commitment of funds to the next round of the next 5-year plan, and this is absolutely essential. One of the issues that I have mentioned in this place before, and I believe is absolutely essential if we are going to close the gap in Aboriginal health expectancy and life outcomes, is to ensure that we deal with the issue of otitis media, which, as I've highlighted in this place before, is an ear infection characterised by fluid build-up in the middle ear, and unfortunately, if left untreated, it results in hearing loss. Now, there's a lot of work going on about how to deal with combating the issues of otitis media, and I very strongly support that work and the funding for that work. But unfortunately, because this disease does strike so many Aboriginal and Torres Strait Islander people, and particularly when they're babies, a baby in a community can get otitis media as young as 3 months old. And in some communities, up to 90% of the babies are affected by otitis media. So not only do we need to be putting the effort in to treating and eradicating and getting rid of that disease, we need to be putting funding resources in to actually addressing the issues around hearing loss and hearing impairment for young Aboriginal and Torres Strait Islander children. Because if you're starting your first day of school and you can't hear, because of loss of hearing impediment, you are not going to be able to participate in that class. And we know that the evidence is showing that if the children are alienated from day one in that classroom, they are not engaging in school, they aren't able to meet education standards, and we know that hearing loss, for example, has been associated with a number of people in juvenile detention and in adult prisons. So the evidence is there that this can have a devastating impact on our communities. So as well as funding the health plan, we need to put a renewed emphasis onto early learning, early literacy, but also programs to address hearing loss.
Thank you, Senator Siewert.